Thanks so much for tuning in again to Scope Notes, your gastroenterology-focused medical education podcast created by learners for learners. For any new listeners, I'm your co-host, Anton Slaughton, current second-year undergraduate student at the University of Western in Canada, and I'm joined by my co-host, Huachi Lee, current second-year internal medicine resident at the University of Toronto. Our amazing faculty advisor is Dr. Parul Tandon, a staff gastroenterologist and clinician scientist in inflammatory bowel diseases at the University Health Network / Sinai Health in Toronto. With Scope Notes, you can expect monthly episodes covering everything GI, from practice guidelines and research updates to unique career insights. We will be highlighting leading gastroenterology experts from the University of Toronto and across Canada, sharing their knowledge and perspectives. Tune in on your favorite podcast streaming app to join the conversation. We would also like to give a special thank you to the Division of Gastroenterology and Hepatology at the University of Toronto for their generous support of this podcast. This episode will be part of a mini-series dedicated to catching up with some of our previous UofT fellows around the world to chat about their careers and reflect on their journeys thus far. With that, let's dive right into today's episode. Today we are thrilled to be joined by Dr. Cindy Law, a gastroenterologist at Massachusetts General Hospital, instructor in medicine at Harvard Medical School, and a trained expert in advanced inflammatory bowel disease.
So hi, Dr. Law. Thank you so much for joining us on the podcast today. First thing we wanted to talk about is you trained at many different top institutions in Canada and the US, from the University of Ottawa to Mount Sinai in New York, and now in Harvard at Mass Gen. Could you walk us through what drew you to gastroenterology and more specifically to focus on IBD?
Thanks so much for having me. It's truly an honor to be here. To introduce myself, my name is Cindy Law. I'm originally from Markham, Ontario, and completed medical school and residency at the University of Ottawa and McMaster University. I then went to the University of Toronto for my gastroenterology fellowship, where I served as chief GI resident in my final year. After that, I pursued an advanced IBD fellowship at Mount Sinai Hospital in New York City, and I'm now an attending gastroenterologist at Massachusetts General Hospital in Boston, specializing in inflammatory bowel disease, and also serve as an instructor in medicine at Harvard Medical School. So in terms of my interest in gastroenterology, my interest was sparked early during my clinical training. I was drawn to the specialty's breadth and unique combination of cognitive and procedural medicine. GI really challenges you to think across systems, manage both acute and chronic diseases, and form longitudinal relationships with patients. I still remember my first exposure to GI during a clinical elective in my second year of medical school. It was the first time I saw endoscopy and colonoscopy up close, and the hands-on aspect and the instant gratification of stopping a bleed or removing a polyp really appealed to me. My decision to specialize in IBD came from several influences. I was fascinated by the intersection of immunology, genetics, and environmental factors that underpin IBD pathophysiology. These patients also often require comprehensive multidisciplinary care, and building long-term relationships with individuals navigating complex chronic illnesses felt profoundly meaningful to me. Seeing patients regain their quality of life and control over such a potentially debilitating condition is also incredibly rewarding.
Thank you so much. Did you know right away that you wanted to do IBD, or did you explore other subspecialties within GI?
I explored several other specialties, and training at UofT, I was very fortunate to have the opportunity to be exposed to different areas of gastroenterology. So one of the unique strengths of the program at UofT is the opportunity to learn from world leaders across all GI subspecialties, not only IBD, but therapeutic endoscopy, hepatology, and motility. And that diversity of experience was invaluable and really allowed me to confirm that specializing in IBD was the right path for me.
Yeah, I think UofT definitely has so many different opportunities. Were there any key people or experiences that you had during your training here that really influenced or shaped your career path?
So, having good mentors is incredibly important. I've been extremely fortunate to have exceptional role models at every stage in training. So in medical school, Dr. Jeffrey McCurdy and Dr. Ashwin Ananthakrishnan provided my first research experiences and really invested in me early on. During residency, Dr. Neeraj Narula and Dr. Zane Gallinger were instrumental in encouraging me to pursue IBD fellowship at Mount Sinai. That was a pivotal decision in my career. And at Mount Sinai Hospital, I had the privilege of learning from world-renowned IBD leaders like Dr. Jean-Fred Colombel and Dr. Bruce Sands.
Thank you. Yeah, I think mentorship is so important, especially when you're deciding on a really important career decision. You mentioned a little bit about your training at U of T. We were just wondering if you could delve into a little bit in terms of reflecting back on your U of T GI experience and how that has played a role in everything so far.
Yeah, of course. So my time at U of T was incredibly formative. The combination of academic rigor and diverse clinical exposure really helped me build a strong foundation. Rotating through different teaching hospitals with varied patient populations broadened my clinical acumen and deepened my appreciation for collaborative patient-centered care. Another impactful aspect of my training was the opportunity to learn from exceptional role models, including several pioneering women leaders in gastroenterology. Faculty such as Dr. Jill Tinmouth and Dr. Florence Wong exemplified excellence, innovation, and dedication to advancing the field. And their mentorship and example inspired me to aim high and to approach my work with both rigor and curiosity. The lessons I learned from their leadership and lifelong learning continue to shape my clinical practice, research, and approach to mentorship today.
Yeah, we had the chance to talk to Dr. Jill Tinmouth on the podcast a couple months ago, and it was so interesting to hear about her colorectal cancer screening experience with implementing basically the first ever screening program in Ontario.
Yeah, she's amazing. Wonderful researcher and mentor.
For sure.
Dr. Law, you've now moved from fellowships into a faculty role at Harvard Medical School while practicing at Massachusetts General Hospital. What has that transition been like, moving from trainee to educator and clinician?
So I've been at MGH now for nearly 2 years. The transition has been both exciting and rewarding. Going from a fellow to attending is a big step. No matter how well prepared you are, it's a little bit nerve-wracking to lose those training wheels. But my experiences at U of T and Mount Sinai gave me an excellent foundation. I'm also fortunate to have joined a very supportive department. My colleagues at MGH are collaborative and approachable, and that has made the transition much smoother. This period has really underscored the importance of mentorship and learning how to balance clinical work and research and teaching. And it's been very rewarding to reflect on the kind of teacher and clinician that I want to be. I want to be someone who leads with integrity and empathy and academic rigor.
Thank you so much. Were there any particular experiences that you had, either more difficult in terms of transition or more rewarding, that have stuck out to you?
Something that's been very rewarding in my first 2 years at MGH is being able to establish our intestinal ultrasound program. So this is an area I'm quite passionate about. Intestinal ultrasound, for those who are not familiar with it, is a non-invasive point of care tool that allows for real-time assessment of bowel inflammation. The technology enables immediate clinical decision-making and reduces the need for colonoscopy and other cross-sectional imaging. So at MGH, the department has been very supportive of establishing this new program. And we also recently launched a dedicated training center for intestinal ultrasound. So very excited to help this program grow and expand and train more providers, as well as explore novel applications for intestinal ultrasound.
That's really cool. I think it's so interesting to be able to implement your own program in a already very busy clinical schedule, I'm sure. You also have a very strong research foundation. We were hoping to get your thoughts on how IBD research and treatments have evolved over the past few years, and where do you see it heading the next 5 to 10?
Absolutely. So the last 2 decades have been truly transformative for the field of IBD. We've witnessed the rapid expansion of biologics and small molecule therapies that target different inflammatory pathways. And alongside these therapeutic advances, there's also been a significant shift toward treat-to-target strategies, focusing on more objective markers, such as mucosal healing to guide treatment. Looking ahead, I believe the next frontier of IBD care is precision medicine. This approach aims to identify which patients will respond best to specific treatments Also, it can be used to stratify those at higher risk for severe disease or complications and personalize follow-up and surveillance schedules based on individual risk.
And what have been some of your biggest takeaways from your experience so far in IBD research?
So the biggest takeaway, in my opinion, is the importance of collaboration. So collaboration is everything. Be open to new areas, research, and be the kind of colleague people want to work with. Be reliable, be team-oriented, and generous with your time.
Thank you. And then lastly, just to finish off, we like asking our guests, do you have any final advice or wisdom to impart on trainees either in medical school who are interested in GI or residents or early GI trainees?
I would say stay intellectually curious and open to opportunities, even those outside of your immediate focus. Academic careers are rarely linear, and sometimes the most rewarding paths come from unexpected collaborations. Secondly, find good mentors early on, not just people who can help you academically, but those who can guide you through the complexities of work-life balance and professional development. Finally, there's no shortcuts. You have to work hard, be enthusiastic, and remain eager to learn. Choose an area you're genuinely passionate about, and that intrinsic motivation will sustain you in the long term.
Dr. Law, thank you so much for taking the time to join us today. Your insights on IBD research and your journey throughout training and practice were incredibly valuable. It was a pleasure to hear about your experiences and the work you are doing to advance patient care and education in gastroenterology. Follow us on social media for the latest updates at UofT GI on X and Instagram. If you have any feedback or just want to say hi, you can reach the team at scopenotes@gmail.com.